Welcome everyone to this powerful series called Speaker X, where we interview people from our own community who have implemented the teachings of different courses, whether it is MDF course from silver to diamond level, or Life Excel, or both, and change their practices to the next level. So it's a wonderful series where you actually land up getting lots of golden nuggets from our own people. And at the same time, if you're someone who is not part of this wonderful community, you also get an idea that how powerfully people work here. As I always say, it's a community of growth mindset people, not the survival mindset people, who just keep on growing, taking things to the next level. And you can really learn a lot from each other, your fellow colleagues, and our community members. So the speaker X today is Dr. Balram Nagar. And Balram, welcome to Speaker X. Okay. And just want you to introduce yourself formally.
So, hello everyone. Myself, Dr. Balram Nagar, and I'm practicing in Noida. So, I started my practice after 2012. So,
Okay, so started practicing in 2012. So it has been like 12, 13 years you're into practice. Okay. So how was your practice in your initial days? And what kind of challenges you used to face? Because all of us, we start practicing and we keep on facing different set of challenges depending upon where you practice and all. So just tell everybody about the kind of practice which you had in the initial years, actually.
sir, in initial years, I started my practice with a single chair practice at a single clinic. Then after some time, वो starting में जब clinic चला, so it was good. एक time के बाद वो stagnant हो गया. And I was nowhere कि कैसे इसको improve करें. So I started the another clinic at the same time. सो वो स्टार्टिंग का फेज एक्साइटमेंट वाला था, वो भी निकल गया, उसके बाद वो भी स्टैग्नेंट हो गया. सो देन आई मूव क्लोज वन प्लेस, देन आई मूव टू अनदर प्लेस. वहां पे भी स्टार्टिंग हुआ, अच्छे से हुआ, फिर एक टाइम के बाद स्टैग्नेंट हो गया. एंड इट वाज लाइक एट अ स्टेज आई की समझ में नहीं आ रहा था कि व्हाट आई वाज डूइंग रॉन्ग. आई वाज वेरी स्टूडियस, लाइक स्कूल टॉपर, कॉलेज टॉपर, और clinic was like not going in a very good direction, and there was no one to guide me at that point also.
Okay, now you shared something really powerful. Okay, by the way, how many of you can relate to what Balram has shared? Type me in the chat box. Okay, you start one practice in the initial time because you start from zero. Even if you make say 100 rupees, 1,000 rupees, 10,000 rupees, that's a big plus. Okay, you get that initial kick. There comes a point when the practice becomes stagnant. Now, let me tell you something very interesting. When the practice becomes stagnant, instead of finding the right way to come out of the stagnancy, to move to the next level, one of the common mistakes which people can make is to start another clinic in another area. And this classically happens in the city practices. This doesn't happen in small towns, by the way, because small towns are so small that even if you start in another area, there is no single patient you are going to get as a different, okay? Even if you get that patient, that will be divided from this practice only. So, lot of people, how many of you have seen people like this, or you are the one? Just type yes in the chat box, okay? That बस यहाँ पर तो practice stagnant हो गया है. Now अगर practice बढ़ाना है, तो मुझे दूसरा clinic start करना पड़ेगा. Big problem, let me tell you. Now, when you start the second clinic, again the same thing happens. The practice kicks in the beginning. Okay, वो take off लेने के बाद जब flight stable हो जाता है, again that practice becomes stagnant. Now, many times the biggest problem comes here. This practice is stagnant, that practice is stagnant. And interestingly, you realize over a period of time that you start losing few patients at both the clinics. True? You start losing the patients at both the clinics. And the worst part is you start becoming the national Kho-Kho player. Okay, moving from this clinic to this clinic, then again to this clinic, then again to this clinic, every single day. Whereas the practice is same. सो खो खो खेलने के बाद भी अलग से रिजल्ट नहीं आता है, इतना खो खो अगर खेल लेते तो नेशनल टीम में चले जाते, है ना? सो एंड देन comes that breaking point, that tipping point, where you'll end up closing one of those two clinics. And now when you close one of those two clinics, you see that you start making the same money in one clinic as you were making in two clinics. How many of you agree? Type agree in the chat box. Okay. And this is a classic story. Now, I just want to, give you two things here. Number one, whenever your practice becomes stagnant, okay, so whatever number of years you are into practice, even if you are watching this on YouTube, whatever, whenever the practice becomes stagnant, your thought process should be how to come out of this stagnation phase rather than starting one more practice. So it's like if you are getting 5 patients in one clinic, okay, and if you want 20 patients, that doesn't mean you start 4 clinics. This is not how it works, okay? So your real approach should be how to grow the practice rather than how to grow the number of clinics with having same number of patients. That's number one. The second thing, when it comes to expanding the practice, that means having the second clinic, third clinic, fourth clinic, whatever. When it comes to expanding the practice, never do it unless your first practice can function without you. I hope you got that. Never do it unless your first practice can function in your absence. And it is possible only and only if your practice is system dependent rather than person dependent. Okay. So delegation and automation is something which is very, very, very critical if you want to build a system dependent practice. If you cannot delegate the practice, if you cannot automate the practice, the game is over. You will end up being a wonderful Coco player. Then eventually, you will start losing your patience. You will become irritable. You will become tired. You will get burned out. And if not anything else, you will start getting hypertension and diabetes and all those good things. Okay. So this is classically how people make mistakes. Having more number of clinics to get more patients is never the solution. Okay. Those of you who have ever started second clinic, I'm sure you can very, very, 100% will be able to relate or connect to what I just said. So anyways, good that you shared this very, very important point, because a lot of people will definitely get a clue from here. A lot of people will definitely learn something from this. Okay. And good. So what happened to your so-called multiple clinics, multiple locations?
And suddenly that COVID phase has come.
Okay.
I got the opportunity to come in contact with you, sir. So उस दिन लगा कि only sir is the person who can take me out from this situation, from Coco position to the other position. So sir, not in the same year, I will say in the same month, sir, I have joined silver level, I have joined Life Excel, and within 3 months, gold as well as diamond member. So
okay. So actually, when you were completely in the mess, okay, the virus came to your rescue, है ना? So and COVID proved to be the blessing in disguise. But when you said that within just 3 months of time you became silver member, gold, diamond member, Life Excel Lite, everything. That I must compliment you for a very interesting thing, and that is that you took the action. I know so many silver members in our community. Okay. In fact, you will be surprised. There are more than 2,000 silver members who did not become gold and diamond members eventually. And that's such a big number. And people just don't understand that there is so much to learn. There is so much to grow the practice. Okay. People attended the webinar. They became, silver members. They learned what they learned, they didn't what they didn't, they implemented something, they didn't implement what they could not, they got some results, they didn't get what they didn't get, they got what they got, and they stopped. That's the worst part. Always remember. Number one, learning is a constant process. Okay, it's not a one-time process. So those of you who are like, hi, I have joined this course, now this is enough. I'll tell you what, it's not about course, it's about mindset. I always say this. You should always be LLL. What is LLL? Everybody type LLL in the chat. Lifelong learner. Even after being 26 years into practicing dentistry, even after being a course or you can say a trainer for almost like 18, 19 years now, even after being a speaker, mentor on practice growth, practice management for 13 years almost now, I still keep on learning things. I still read new books. I still watch new videos. Okay. I still attend courses, believe it or not. I still keep on upgrading myself. Upgradation is never a one-time process. It's an ongoing thing. And if you're someone who is not, LLL, trust me, you will become stagnant once again and again and again. Okay. So keep on learning. And the best part is, I'm so happy, Balram, that, you took all those action steps within like less than 100 days. And naturally, when you are in such a big action taking mode, I just want to know your, thought process, your psychology. How did you work on your multiple clinics, and how exactly you concluded whatever you concluded, and how you moved ahead?
So, sir, in the first 100 days, I was started with all the courses and learning, sir. And at that time, I would really like appreciate, sir, my buddy Jitu, sir, who supported me. And in the next 100 days, I closed all my previous clinics. And I started again with a new clinic at a new place with a zero.
Oh,
And
that's powerful. That's powerful. Okay. So when a lot of people have, again, now another very powerful point you shared here. Lot of people don't even want to change the name or logo of their clinic if they find that I can create something better. How many of you can relate to this mindset or understood what I just said? Type yes in the chat box. We get so many messages, so many questions in our courses or live sessions. Can I change the logo? Now, when they learn in Practice Excel, when they learn at gold diamond level that logo should have an emotion, color theme, ye wo, blah 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 blah, and people are like, but then my clinic is like 15-year-old. How can I change the name? How can I change the logo? How can I change the color theme and so on? Guys, this is how you do it. Forget about changing name, logo, and color theme. You can literally close everything and start from the scratch once again. Okay, go ahead.
And sir, like within the first year only, वो तीनों क्लिनिक का रेवेन्यू एक क्लिनिक से स्टार्ट हो गया ना सर.
My God, that's now, guys, look at this. Okay, you just should write, strong in the chat box. Look at this. A person who, closed all 3 clinics and starts from the zero at 4th location, and the combined revenue of the 3 clinics is crossed within first year itself. You really need, imagine the kind of mental toughness you need for this. Okay, wonderful. So just go ahead. How did you do that?
So sir, at that phase was very difficult sir. वो पहले खो खो खेलना, फिर 3 महीने कुछ नहीं करना और क्लिनिक पे बैठ के सेटअप को रेडी करना, watching your videos, and one thing more I implemented is like reading books. I used to read books like 1 week, one book is enough. So that helped me to have the strong mental patterns. And my buddy, he was always there at any of the time. Some of the time it was like, sir, at 12 or 1, I called him. I'm in such a mess. How should I go further from there? So he was, every time he was ready at that point. And sir, I'm so lucky to have this community at that point also. So I got so many good new friends which are always there to help me. So I will like to name couple of them, sir, if you allow. Yeah, like Sir Gul ma'am was always there. Tejal ma'am was there. Our super leaders were always there. Pratik sir, Mahesh sir, and Vishwas sir. So these are the people who constantly वहाँ से energy मिलता रहा, and I was implementing all the things which I have learned in all the silver level, gold level, and the life excel. So that was like within a year I was able to generate more than that revenue.
Go ahead, go ahead, go ahead. I'm here only.
Okay, sir. Thank you, sir. And then after 1 year, sir, same situation again comes. वो stagnation वाला phase फिर से आया. So at this time, I have वो नया clinic वाला thought तो बिल्कुल ही भूल गया मैं. But no, there has to be something which I have to do. So
Nice.
at that time, I start doing weekly SWOT analysis of my clinic and myself. So that
Okay.
has helped a lot at that point to come out of that zone and start implementing new things which I was not doing. There were so many things, like sir, I will like to mention. In the SWOT analysis, I came to know about I was very fearful of suturing.
Okay.
So suturing नहीं करने के डर से I was not doing implants, I was not doing disinfections, I was doing any surgical procedures. And sir, at present time, my 70% revenues from surgical part only. So overcoming that one suturing ka fear has given me revenue to the another level. That I came to know about why SWOT analysis, sir.
Look at this, guys. It's powerful, absolutely powerful, isn't it? Okay. So you start from zero. You cross the combined revenue of your 3 previous practices literally in 1 year. Then again, you get that stagnation. But then this time, you don't make the same mistake. The mistake of starting one more clinic. Okay. Always remember, I always say this, making new mistakes is fine, but you should not keep on making same mistakes again and again and again. And then the best part which he shared was he did the SWOT analysis. Okay. What is SWOT? SWOT is nothing but the analysis of your strengths, weaknesses, opportunities, and threats. As you all know, if you're part of our community. Okay. Doing the SWOT analysis, understanding that surgery is the fear, suturing is the limitation. Working so much, traveling to different places, doing implant cases, doing surgeries, observing them, and then comes a stage in the practice where 70% of your revenue comes from the surgical work. और दिन भर सीते रहते हो. बढ़िया. Okay, wonderful. So how, apart from the SWOT analysis, what else worked for you in, from our curriculum? So what was the game changer? If I can ask you like top 2, 3 things, which really helped you to take the game to the next level, what would they be?
Sir, it's like meeting new people from our community.
Nice.
So I was getting a very, whenever I got an opportunity, whether someone has come to Delhi or nearby area, I used to travel and spend my complete day with them to know okay, how are their thought process, how they implement the things. So like you have tell me कि बताया कि sir आपको we have to implement your consultation formula like this. And तो वो उन्होंने कैसे किया, how can I improve myself? So that was a constantly how can I improve myself was the first thing. Secondly, being in this community, every time, every session, that has take to the another level. And sir, third thing I will like, पिछले 4 साल में 4 क्वेश्चंस नहीं मैंने पूछे होंगे in the live session till now, but I am getting all the answers at without asking it. So that's the power of this committee. कोई ना कोई किसी ना किसी way में I got the answers, and just what I have to do, I just implement.
This is wonderful, isn't it? So look at this, guys. So, I'm so happy, proud that, we could actually build a community of such a wonderful people like you all, of course. Okay. And it's like, even if you don't ask the questions, you still end up getting the answers. There's a very nice saying, if something is meant for you, it will find you. Okay. So you'll end up getting the answer. And that's the reason I always keep on saying, always attend our live sessions. You will never find anybody in this country. You will never find a mentor who conducts so many live sessions free of cost for the community members, isn't it? So I do all this. Even today, I'm not well, but I still thought that I should not postpone or cancel the ICM. I thought let's make it short, but okay, I'll still do it. Okay. So use this community to grow. Okay. Balram also talked about the buddy. So we have a wonderful system in Life Excel course called the buddy system. Okay. Use this buddy system to grow. And everybody in our community knows Balram and Dr. Jitendra Kumar's jodi as Jai Viru ka jodi. Okay. So learn from our community. You don't trust me. You don't need any other source to learn. I'm not joking. Okay. This community is absolutely full of super powerful people. Meeting new people, very, very important. Okay. And that's why whenever we have any offline session, may it be any of our Life Excel session, may it be ExcelCon, our annual conference, don't miss coming to offline sessions no matter what. आपको इस देश के इस कोने से उस कोने पर भी ट्रैवल करना पड़े ना, don't miss meeting this community. You will go mad with the kind of people we have in this wonderful community. Okay. So keep on meeting people, keep on learning from them, keep on listening to them, give them what you do. You will understand, share, with them, and you will understand what you are not doing right, or what is that missing link in your practice, and it will take you to the next level. Very, very good. I'm so happy that, you really use this community and implemented things, learned things, attended all the live sessions, got all the answers, and took your game to the next level. So what kind of growth you have seen, say your first clinic to wherever you are placed right now, in, post-COVID, in last 4 or 5 years, what kind of growth you have seen in your practice?
So I'm so happy and excited to tell you that last year it was the 4x, and this year it's going to be the 5x. Almost there, sir.
Okay. So 5 times practice growth in 5 years. Powerful, isn't it? And I'm really happy for you because you are one of those silent observers, but action takers. Okay. So 5x practice growth. And as I always, everybody, please give a congratulations to him. Okay. So growing your practice 5 times in so-called cutthroat competition era, and dentistry में तो कोई scope नहीं है, dentistry में तो पैसा ही नहीं है, dentist तो कुछ भी कर... No, I'll tell you what, where there is a will, there is a way. Okay. If you are determined, you will be successful. Nobody can stop you. Let me tell you. Okay. Nobody can stop you except you yourself. So rather than giving excuses, rather than giving reasons, I want you to pull your socks up, take responsibility for growing your practice, and make it big. Because again, if you don't get those 5x patients, trust me, the patients are anyways going to go to somebody else. उनको तो दांत का ट्रीटमेंट करना ही है. If they miss a good dentist like you, simply because you are not an action taker, they will go to some other action taker dentist. It's so simple. Okay. So there is no shortage of money, name, fame, patience, teeth in this world. Okay. This world has, imagine, 7 billion into 32 teeth. Okay. So there is no shortage of anything. If there is one shortage, the shortage is of the mindset. The shortage is of the discipline. The shortage is of action taking. And the shortage is of having that fire in your belly, that passion. Okay. Yes, Balram. So if you have to give some, parting message to everybody here, what would that be?
Sir, I would like to give 2 messages. First, always do charity. That was the number one thing that I was not doing and getting it, or to passing to another level. Once I started with the charity, it has like game has changed, sir, from the day I started doing charity very sincerely, sir. And
Wonderful. And second?
And second, sir, it's like whether आप कहीं भी stuck किए हो, if you want to grow from that level, you can definitely grow just following this community blindly and joining and following the mentor blindly.
Okay, wonderful, very powerful. Now look at this. A lot of people think when I speak about charity, okay, and in fact, a lot of people started doing charity only after being part of this community or becoming part of this community, because people never understood the importance of doing charity. लोगों को लगता है कि I will give when I will have more. Okay, trust me, it's other way around. It is only when you give you will have more. Okay, so if you want to have more, start giving first. There is no substitute for charity, let me tell you. At least 5% of your net income must go in charity. Okay, that's number one. And as second thing Balram said, literally, be very active member in this community. Don't just sit and edit. हाँ ठीक है भाई, email आता है, ICM होता है, C3 होता है, Life Excel होता है. No, ऐसे ही नहीं होता. There is a reason why all these things happen. They happen ready-made for all of you. Okay, but if you are someone who is not going to take action, who is not going to be there, if you are someone who is not going to implement, you will not get the results. Okay, and as Balram also said, follow your mentor blindly. This is something which I always say. This is something which I have always done in my life. Okay, जिसको भी mentor माना उसने बोला कूद जा तो कूद जाने का. I'll tell you this is the best way to get maximum from mentor. In fact, the other day I was just watching a reel, rather a short video, and the interviewer asked one of the billionaires actually, and he asked, I have heard that there is no substitute for hard work. Okay, and that billionaire guy said, that's wrong. There is a substitute for hard work. And you know what? Have a mentor. Mentor will ensure how you can really grow very, very quickly in your life. 5 times growth in 5 years, I'm sure it's worth, right? Rather than jumping from one clinic to another and playing that coco, and at the end of it, getting frustrated, getting tired, burning out yourself. Okay, and eventually losing this beauty, wonderful smile which Balram has on his face. It's so easy to do it. Trust me. Okay, it's so easy to do it. So be very active here. Join all our courses, whichever you have not done, whether it is Practice Excel, Life Excel, Diamond member, Gold member. I'm telling you, whatever money you spend here, it's the best investment you can always make. Okay, be here, take action, implement things, meet people whenever you can. Never miss a single opportunity to meet this community people. I tell you, we individually, we are none. But I'll tell you what, collectively, we are probably the most powerful force in dentistry in this country. Okay, so never miss any opportunity to meet each other in the offline world. Okay, and keep implementing, keep growing. And Balram, very, very happy. Congratulations once again for your success. And all the best to all of to you, simply because, as I say, this is just the beginning. Abhi to party shuru hui hai. Okay, so thank you so much for being Speaker X. And with this, let's conclude this Speaker X session.